about process monitoring, process evaluation. Everybody's cool with that. Everybody knows what they're doing. Okay. So you're like, yeah, sure, we know what we're doing. Okay. So, tonight we're going to talk about short-term evaluation. And so like process or like implementation evaluation, you're going to have what we call outcome monitoring and outcome evaluation. So, let me skip to that. Before I go any further though, I did look at your syllabus. Next week we will talk about your exam, because your exam is actually 2 weeks from today. Your exam will be online on Web Campus. So we'll talk next week about what's going to be on the exam. I mean, obviously everything that we've covered to this point. And then when the exam will be open online. So, again, this should look familiar. You've seen this before. What we don't have here is the social assessment, but that's really kind of related to your goals and kind of more big picture kind of thing. So, planning, evaluation, we talked about process monitoring, process evaluation, which really relates to your administrative and policy assessment. Tonight we're going to talk about outcome monitoring, outcome evaluation, really focused in on your educational and ecological assessment, but it can also include behavioral or environmental assessment depending upon how long your project is, what your behaviors are that you're trying to change. Some things, you can change very rapidly because they're new behaviors, so you can look at those in a short-term perspective. Sometimes it won't because it's more longer-term outcomes, and so it takes a little bit longer. Here, we call it outcome monitoring and outcome evaluation, and we call this impact evaluation. Schools of public health, this is CDC terminology, okay? So this is federal government terminology. Some schools of public health will flip outcome and impact, so this will be impact evaluation, and this will be outcome evaluation, okay? So just when somebody's talking about those, just be very clear on what it is that they're talking about. So kind of as a refresher, and I know you guys know this, the educational and ecological assessment, you're looking at predisposing factors, okay? So things that people have in place before the behavior as it relates to skills, knowledge, attitudes, beliefs, etc. And then we have reinforcing factors, which are going to be things that reinforce the behavior. So it's, going to be that positive or that negative reinforcement. It's going to be punishment, those kinds of things that you might have going on. Think about any reinforcement that you're giving in order to get somebody to continue the behavior. And then you've got enabling factors. Enabling factors usually relate to the environment, but they also can relate to new skills that a person needs to have. Okay, and so at this point, hopefully all of you all have taken behavioral theory, and so this is where behavioral theory fits in and why you take that class. So looking at those variables that are going to influence and increase the likelihood of a behavior occurring. Okay, so it could be any number of behaviors that you might be, or any number of theories that you might be looking at. So and I said this already in terms of the predisposing, reinforcing, and enabling factors, but again, we're looking at knowledge, attitudes, beliefs, skills, etc. Okay, so these might be new skills that a person needs to have, or it might be old skills that they already have. So at this level of evaluation, these are going to be the things that we're going to be looking at, and we'll talk some about how do you measure some of that. So then we also have the behavioral and the environmental assessment. And so remember, the behavioral assessment, you're looking at the behavior that needs to change, or the behavior change that needs to be made, but you're looking at how do you want people to act. And then with the environmental assessment, you're looking at aspects of the environment that support either the improved health status or the behavior change that you want. So remember here, environment can be physical environment, but more likely it's going to be social environment, or it's going to be the healthcare environment. So what do people have access to are going to be kind of the issues that you're going to be talking about and dealing with here. Okay? So it was a quick summary of what these lectures are really, yeah, I cover these in...
It really is. It's good.
I could normally cover these in 4 weeks, and I just did it in less than 10 minutes, so if you don't remember, go back and look at your notes. So, outcome monitoring. So, outcome monitoring means that you're looking at whether or not you're meeting your outcome objectives that you set, as well as your efforts in terms of meeting those outcome measures. So, your intervention is going to say that, you may have increase in abstinence, or you may have a increase in people who believe that condoms are useful in terms of preventing STDs and HIV and teen pregnancy, blah, blah, blah. And so now we're measuring that. We're just measuring it. Really just want to know, did we make any change? Okay? Not necessarily did our intervention make the change, but did we have any change in our target population? So the key thing about outcome monitoring is you're going to collect data on your outcomes before and after the intervention. Okay, so the thing is, you want to know if you're making these changes in attitudes, skills, behaviors, you got to know what's going on before you implement the intervention and then what's going on after you implement the intervention. Okay, so I know people are always quick to say, oh, we'll do a pre-test, post-test. Not exactly right, okay? Pre-test means you're doing something beforehand. Post-test means that you're doing a measurement afterwards, okay? But you may not be doing a test or a survey. If somebody's doing a skills demonstration, then you're doing something pre-intervention and then post-intervention, okay? So don't get lax in your language and saying we're doing a pre-test, post-test, because oftentimes that infers or implies that you're doing a survey or some other kind of testing method, and that may not be the case, okay? You may be doing something else. So you've got to know what's going on beforehand so that you can compare it to what's going on afterwards, so then you know, are we making progress? Are we meeting our objectives? Are we at where we should be in terms of what the intervention tells us we should be in terms of our measures, okay? So how do you know? And again, back to my previous statement. I put this box up here because I want you to think outside the box, okay? So yes, surveys are good, surveys are easy, blah, blah, blah. But also try, especially if you're talking about skills, getting people to demonstrate what it is that you want them to do. Okay? So if you want to teach people how to use a condom and you want to know whether or not they got it, then do a condom demonstration. Have them show you, here's how to put a condom on. And then you would need a checklist where here's the steps that you're supposed to do it, and then make sure that they're following those steps. But the same thing also could be said in terms of negotiation skills, in terms of being able to, choose fresh fruits and vegetables or low-fat foods at the grocery store. Have people actually demonstrate it. Is that always feasible? No, because you can't always just go to the grocery store and have everybody sitting around and showing you, that they can do this kind of thing. But when you can, try to do that. So it really validates what it is that you're doing, because you can say, here are our steps, which came either out of the intervention or from the literature. Here's what people need to do. Here's what we taught them. And then get them to actually demonstrate. Here's how to do it. Okay? Also look at role playing, particularly if you're talking about negotiation skills or being able to communicate in a certain way. Have people do role play. The thing about role play is everybody loves it. Some people, people act like they don't, but some people love to be dramatic and they love to act and they love, being able to be creative. Others may not always like doing it, but they like sitting there watching, and they learn from others watching what it is that they're doing. So you could do role plays. You could also do observations. Okay, so you could walk around the room and observe what people are doing. Okay, again, having a checklist though in these kinds of situations so that you can go through and tick off what people are supposed to be doing is something you need. Interviews. Okay, so you can just ask people, what is it they're supposed to do, how do they do this, or what is it now that they value, believe, hold important based on after participating in your intervention? Okay? All of these things are things that you can do. What I wanted to take a moment and pass out, you guys have all taken behavioral theory, right? Okay, so you've heard of the trans-theoretical model? Okay, so University of Rhode Island Cancer Prevention Center is the keepers of the trans-theoretical model. Okay? And so what I have printed out for you is this first page, and it's front and back, which I know is kind of funky, but my printer's doing that nowadays. But the first page is just an overview of the trans-theoretical model. Okay? And then on their website, for different behaviors, they have survey tools based on the trans-theoretical model. So what I did was print out for you the survey tools related to smoking. Okay, so you can see how questions could be asked if you were going to do them in a survey, what you could be looking for, things like that. So they have a stage of change survey, and looks like this is the short form, so it just says, basically it looks like it has like the one question, are you currently a smoker? And then it's yes, if they are currently a smoker, then how many times in the last year how many times have they tried to quit smoking for at least 24 hours in the last year? Then are they serious with quitting smoking? So based on these questions, and you can see where, if they answer, then it relates to a particular stage of the trans-theoretical model, one of the stages of change. Then you've got processes of change. So talking about, there's a short form, and then there's a long form. So looking at things that people can do to move them along the stages of change. So the processes of change is what helps you move along through the stages. So looking at either the short form or the long form, based on how people answer those questions, you can then figure out where they are in terms of the processes of change. And then self-efficacy, they have a short form, which is, interestingly, they relate it to temptation. So they have a short form, then they have a long form. So you can look at self-efficacy and temptation and the roles that plays in somebody's behavior change. And lastly, they have decisional balance. So they have a short form, and then they have a long form. So you can look at where people are in their decisional balance and what it is that they want to do. And I bring this to class so that, you know, we always say, oh yeah, do a survey looking at behavioral theory, things like that. And I know deep down inside you guys go, huh? What? How do we do this? What does this look like? And so with stages of change, this is really a good one to look at, and you have surveys there. If you go to the University of Rhode Island's Cancer Prevention Research Center, they have surveys related to other areas of behavior change, so like condom use, physical activity, physical activity, so on and so forth. I mean, there's a lot of different ones up there, and they've been validated already. So there's no reason for you to like start from scratch and develop your own survey when they have these surveys already up there. So when you're thinking about collecting this kind of data and saying, okay, well, how do we know things have changed from beginning to end? This is one way of looking at a behavioral theory and at those constructs and getting at the attitudes and beliefs as it relates to making a behavior change. Does that make sense? And, like, so in some of your interventions, for example, they may have information or surveys that you can use related to that. In other interventions, they might not. And so then you've got to scramble around and look for something and figure it out. Always make sure if you're going to develop something that you kind of have other people read it and make sure that it's collecting all of the data that you need. The other thing too is you're saying, okay, we're using trans-theoretical model, and so this is multiple tools. You could put those in one survey instrument along with, like if asking people, did they buy the patch or whatever else they might have done. How many sessions of your smoking cessation class did they complete? You could ask them all of those things in the same survey. You don't need to have, like I've printed out, each individual survey tool to give out to somebody. Just put it all in as one. Just make sure you know which questions go with what area that you're asking for. It won't make sense to the people who are completing the survey. Does that make sense? Okay. So, in many cases, when you're doing outcome monitoring, you're going to be administering a brief questionnaire before the intervention begins and then again after it's finished. So with outcome monitoring, what you really want to answer is, did the expected outcome occur? So going back to our survey, if we say that our intervention is going to increase self-efficacy, then we can look at those questions and see pre-test where somebody was, and then at the end of the intervention where somebody is. And then we can compare those and say, yes, we increased self-efficacy, no, we didn't. Okay? Which is part of the reason now you take biostatistics, because now you can look at if that difference is statistically significant. Okay? So if you're looking at things like behavior change, then you might have survey questions or something somehow that collects behavior. Most times though, you're checking just attitudes, knowledge, skills, to see whether or not those have changed from pre to post. You may have some environmental changes that occurred from pre to post. So you just want to look at those and say, okay, what happened? What was going on pre-intervention? usually right before you begin the intervention, and then post-intervention, so immediately at the end of the intervention. So when we say immediately at the end, it's not that you go off and like it's the end of the semester and now I have you come back a week later and fill out a survey. It's okay, instruction is done, boom, now you take the post-survey. Okay, and then you can, depending upon what's going on, if you want to see how long those changes last over time, then you would have people do follow-ups, maybe 30 days, 60 days, 90 days, or 30 days, 3 months, 6 months. It just kind of depends on what it is that you're looking for and what your intervention's trying to do. So, any questions about outcome monitoring before we move on? I know, once again, clear as mud. So, we'll do some activities at the end so you guys can kind of get a feel for it. So, outcome evaluation. Outcome evaluation is going to be very similar to outcome monitoring. So with outcome evaluation, you're now going to use what we call rigorous methods. So in other words, you're going to use some kind of research design or evaluation design to determine whether or not the prevention intervention had an effect on the predetermined set of goals or your set of objectives. So you want really at this point you want to know, did your intervention cause the changes that you're seeing? Okay? So you're using these rigorous methods or evaluation design so that you can rule out factors that might otherwise be responsible for the changes that you're seeing. Okay, so in this type of evaluation, the ultimate goal is to make sure that your intervention caused the changes that are being seen. Okay, so you're going to want to have a group that gets the intervention and then a group that doesn't get the intervention, and then be able to compare their results before the intervention and then after the intervention to see whether or not you have changes in either group. Okay, and you're going to want to look at some things that might also be responsible for that change that you're seeing. So for example, we've seen this happen over the years with smoking cessation programs, especially early on, like in the early 2000s when they first became popular, is, people would say, like, somebody's job will say, oh, we're going to implement a smoking cessation program. Okay? And then they're trying to evaluate whether or not it worked. Well, all of a sudden now they see, hey, we got high rates of people quitting smoking. But their agency also, or maybe a law within the state or the county got implemented, that's a Clean Indoor Air Act. So there is no smoking at work. There is no smoking in the office. So it wasn't the fact that you implemented the smoking cessation program on your job that caused everybody to stop smoking. It was the fact that the law said you can't smoke in your office anymore. Okay? So those are the kinds of things that happen, and we'll talk about other things when we talk about measurement issues. Things that happen that are going to influence, your results. Another thing that can influence your results is you get people who drop out of the program. So if you get high rates of dropout, and when we say high, I mean really, they say anything over 10% you should be looking at in terms of there might be something going on. So if you get, like 50% dropout in one of your groups, then there's something going on with that intervention or what you're doing that's causing people to drop out, because the ones that stay are going to be the ones who've bought in hook, line, and sinker. So you're going to have those automatic differences at the end between the groups, because the ones that stayed in your intervention group were the ones who got it. Okay? So you've got to look at these, what are the differences in what's going on? Are there other things that could be happening that might be influencing your outcomes that have nothing at all to do with your intervention? Because you want to say that your intervention is the one that made these changes. Okay? The good thing for most of you all is that outcome evaluation is not generally done by community-based organizations, or for that matter, even state and local health departments. It's becoming more of a research kind of thing in terms of proving or ensuring that interventions are evidence-based, and not something that if you were going to be funded, for example, to implement an intervention, that you would have to do for the evaluation. Okay? The assumption now on the federal level is if you implement the evidence-based intervention as it's supposed to be implemented, and you can document that, then in theory, you'll have the similar changes that the original intervention had. Okay? So they're not expecting you to go out and find control and comparison groups or anything like that. They're just like, just do the basics. Okay? Let me say this other thing. This is where fidelity becomes very important. Okay? This is where your process monitoring and your process evaluation become very important. Because if you're not implementing the intervention as it's supposed to be, as it's been designed, as your program plan said, then you don't know what you're implementing. So this becomes meaningless. Okay? So if you're going to do this, then that process monitoring, that process evaluation becomes very, very important in terms of making sure that you're implementing the intervention as it's supposed to be, and you know and you understand what that intervention is supposed to do. Okay? So I've kind of said this already, but you're looking at your outcomes before and after the intervention for your clients or your participants, as well as a similar group that did not participate in the intervention. Okay. So and this is in part one of the reasons why most agencies, most organizations don't do outcome evaluation, is choosing a control or comparison group. Okay? So control group means that you have some kind of random selection or some kind of randomization, random assignment of people who get assigned to your intervention group or your control group. Comparison group means that you have people with similar characteristics. So you know, like you have this class, and so now we're comparing you to another class, similar size, similar makeup, etc. Okay? And it's not always possible. Okay? So think about a school situation. Okay? Let's do elementary school, for example. You can't randomly choose kids out of a class to participate in the program and have kids in the same class not participating and compare them. Okay? Think about it. Like, I'm going to say, like, we're all in the same class. You guys are going to be in the intervention, and you guys aren't. At some point, really, you guys are probably going to talk. Right? And somebody's going to say, oh, so what did you do today? And you're going to be like, oh, well, you know, I'm in this program, and I'm supposed to have 6 glasses of water, and so this is my 6th glass of water. And you're going to be like, really? You have to have 6 glasses of water? Maybe I should try it. And then you're going to try it. And now, where was the intervention? Okay? You know, sometimes you want to use ready-made groups. So, you know, like, so instead of going, okay, we're going to randomize by or choose intervention and comparison groups or control groups by individual students in a school, maybe we'll do classrooms, okay? But again, if you think about elementary schools, they're all, you know, all of the 6th or 5th grade teachers are all down at this end of the hallway. So they still have some interaction, and sometimes the classes change, you know, like for English, you know, like I don't want to say the smarter students, but, you know, the top of the line students will be in one class, and the other students who need a little bit more work may be in another class. So you still have that interaction. So now instead of like by classroom, now you've got to look at maybe by school. Okay? So now this is where, you know, you've got to look at demographics of the school. You know, is it Title I, so are they low income versus not Title I? I mean, obviously you wouldn't want to compare like a Bishop Gorman, a private school, to a Title I school, high school kind of thing. So you've got to, you know, kind of do that. And it's hard. It's hard. It's hard trying to find schools that match. And in this day and age, where kids are less likely to interact, okay? Because that's the issue. You don't want them interacting to the point where they're, blah, 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 and now, you know, they've told your intervention, and so somebody else is doing your intervention, and you're not having differences because everybody's now doing your intervention. So you have to think about it. Sometimes there will be situations where you won't be able to come up with a control or a comparison group. Okay, so, you know, I've talked about this training institute that I used to help run in Atlanta. So it's a program that people get selected to. They have to apply and they would get selected to. So you have a group of people who got selected and who participated, and then you have applicants who applied and didn't get selected. Okay, so you can't really compare them because there was some difference as to why some people got selected and some people didn't. And you didn't always have enough that got selected but did not participate. And even if they did not participate, it was usually because of some issue, like, you know, like they couldn't get off work, or they changed jobs, or, you know, family issue. So, you know, they weren't as likely to participate. So, I mean, like, we sat around, you know, spending hours, like, okay, well, what about this? Or what about that? And then we just could not come up with a comparison group. And that happens, you know. I will force you guys in this class to think, you know, very strongly about who's a comparison group. So if you're going to do, you know, something where you're doing something in Clark County or the city of Las Vegas, you know, I'll say, who's a control or comparison? Who's a comparison city that you could use? You know, think about Albuquerque or Salt Lake. Although Salt Lake, not because of the heavy Mormon presence, is not as comparable. But, you know, I will encourage you to think of other places, Intermountain West or whatever, that you can compare what you're doing to here. Okay, because, you know, you're going to have to say, somebody at some point will ask you, how do you know it worked? Okay, and if you are trying to do this outcome evaluation, then being able to answer that control or comparison group question becomes very important in thinking about it. So this semester, as we go through, we'll talk about the research design, so we'll come back to this and talk about the different kinds of designs. I mean, a pre-test, post-test is the simplest of designs, you know. So again, you know, thinking about the language that you use, don't always get caught up in the pre-test, post-test. Think pre-intervention, post-intervention, etc. Yes?
So, for example, if you're doing the comparison city thing, right? Let's take Las Vegas. Like, we wouldn't want to use Boise as an example to compare to Las Vegas because the demographics would be different, right? Like, if we think about, you know, different minorities we have here versus there, would that be a limiter in some ways because it'd be difficult to find?
Well, it depends upon what exactly you're looking at. If you're trying to compare Las Vegas in general to a particular city, you're going to have obviously some challenges. On the other hand, if you're looking at, for example, we have a large Mormon population, you know, so then comparing the Mormon population in Las Vegas to, say, Salt Lake City or some other, you know, big suburb outside of Salt Lake, that's kind of reasonable, doable.
So it depends on your target population.
Right. Right. So who's going to be receiving that intervention and finding similar people who won't be receiving that intervention. Okay. And so one question too that always comes up in these discussions is, well, what happens when, you know, it's just in this day and age, it seems unfair to give one group something and the other group nothing. Okay. And so we'll talk about some of that in the design, but you can give one group your intervention and the other group a completely different intervention. So you may be, you know, like in your case, for example, let's say you're doing an HIV intervention, so, you know, your intervention group gets the HIV intervention, then you have another group that's getting something around fresh fruits and vegetables and physical activity. So they're getting something, you know, not nothing, okay? And in this day and age, I mean, people want something. You know, they want, I mean, I'm real good for, you know, when somebody sends me a survey, I'm like, okay, what am I getting out of this? If I'm getting something out of this, like if I'm going to get an Amazon gift card or, you know, a couple dollars, if I'm going to get something out of it, I'm more willing to participate than if I'm not getting anything. Especially if you want, like, if you want my information, you want my thoughts, you want who I am, where I am, you know, all of that. I mean, that's valuable information, and so I feel like I should be getting something out of it. The other option too is, and we'll talk about this in the design part of it, is you have one group A, who gets the intervention, group B who gets nothing. Okay? You go through a cycle of the intervention and then maybe you have a break, and then group B gets the intervention and group A doesn't get the intervention. So you still have that comparison to see whether or not they actually learn something, and so on and so forth. But that's, in this day and age, again, with everybody wanting something for, participating. What do you mean? You're just gonna send me a survey every 3 months and I'm gonna fill it out, or every week or whatever, and I'm supposed to be okay with that? People are like, not so much, And especially, when you think about it, if you're asking sensitive information, then, you should try to give people something when you can. So, and that's not to say, sometimes you just can't, and I get it, as a student, you ain't got that kind of money. So, those of you that are doing stuff for your graduate projects, you don't have that kind of money to give people something. But, as much as you can, you should think about doing that. So, I told you we would see these tables again. Okay? So, our logic model outcome is that we want to increase condom use skills. So, we want to know, did the intervention increase the number of clients who were able to correctly use a condom? Outcome monitoring, outcome evaluation. What do you think? Monitoring?
I think it's evaluation,
Evaluation?
because you want to see if the intervention caused a change, right? Like, did it do something?
Okay, I know I saw at least 3 for evaluation. How many? Joanna, where are you? She's like, that's a darn good question, Dr. TR. The evaluation question right here, I'll answer it for you.
Evaluation.
Okay, it's outcome evaluation, because we want to know, did the intervention increase?
What did I say?
You said monitoring.
Oh.
She's like, wait a minute, no, that's not what I said. So if this was going to be outcome monitoring, then we'd say, did the number of clients who were able to correctly use a condom increase? We wouldn't have anything about the intervention. So did the number of clients who are able to correctly use a condom increase? Not did the intervention cause. Okay? So here's our objective. Okay? So the objective, by December 1, 2010, 85% of African American, this is men who have sex with men, participants who did not initially have condom use skills will be observed to have condom use skills in role play. Okay? So, we're saying that we have, let's say, 100 participants, 100 men, and among those who did not have condom skills, 85% of those men will be able to demonstrate condom skills in role play. Okay, you see that? So it's not 85% of all the participants, it's only 85% of those who did not have condom skills, which implies that you gotta know who did not have the skills. Okay? So you gotta do some pre-assessment first of who has skills, and then to identify who doesn't have skills, and then at the end figure out who does have skills. that make sense? I mean, it seems a little convoluted, so I always want to make sure people understand. Okay, so the indicator is a percent of clients who demonstrate at least 5 of the 6 skills for correct condom use. So there's some kind of role play or some kind of demonstration. We have a checklist that we're looking at, and they're going to do 5 of the 6 things correct. Okay? Because again, think about it. If you want them to do all 6 things correct, then 85% might be kind of high. Okay? And if they're doing it in a role play, then there, could be something funky about the role play for why they didn't do it. So, here's your source of evidence. So you're going to have a report on the observed condom use skills during role play, before and after the intervention. And so you're going to have, again, that checklist. So you're going to have the person's name on there. You'll have probably a date, so you'll know, this was pre-intervention or this was post-intervention. Or if you're doing it all in the same day, you might have even going different color sheets for the checklist. So you still have a person's name on there, but you have just, green might be pre-intervention and blue might be post-intervention. Okay, so that's how you can easily tell. And then you're going to have the 6 steps on there, and then you're going to just check off whether or not they did 5 of the 6 things. Simple enough? Okay, so I still have the tables from not last week, but from the time before. So if anybody needs tables, and then do you guys want to work through one together and then work through one separately, or do you feel froggy enough to work through one together? Or work through it by yourselves as a group? So you want to do one together? Okay.
And now we Never know when you need a pen.
Okay. Alright, so I'm going to turn this off. I'm going to raise this up. So, and you guys have, I gave you this one, right?
Yes.
Okay.
I don't think I have it.
You don't have it? Oh my gosh. No.
You need one?
Let me see. Yep, that's all I got. All I got.
Share.
Yeah, I was gonna say share. And I'm gonna need so I'm gonna leave the logic model outcome off. And then source of evidence. Alright, now let me check this. Okay. Okay, so give me one of the outcome monitoring outcome evaluation objectives?
By 2006, HIV service for bisexual Haitian men will be increased by 50%.
By okay, so by 2006,
HIV service for bisexual Haitian men will be increased by 50%.
okay, so first question first, just so you can relate this back to where we are with everything and relate it back to planning. Which assessment does this come out of? What is this related to?
Environment?
Yep. Just make sure you guys, like we're connecting all the dots here. Okay, so, what's gonna be our evaluation question?
Did the services, or did the access to services increase for HIV Haitian bisexual men? Because you want it by 50%, would the 50% be included in the evaluation question?
Did the intervention
So,
increase
okay, wait a minute,
services?
so, alright, hold on.
Sorry.
I'm trying to figure out where to write this. Let me write the first one. What did you say?
I said, did the HIV services available for bisexual Haitian men increase? And then my question was, do we have to put by how much our target was?
For this question, I would say yes.
Okay. Would we be at least 50% or just by 50%?
You can say by 50%, and then if it goes higher than that, then you know you've met your objective. Does anybody have another question?
I was just gonna ask, did the intervention increase the HIV services for bisexual patients by 50%?
Any other questions? What if we asked, just another way of asking the question, so by how much did the services for Haitian, HIV services for bisexual Haitian, I left words out. Haitian men increase. Yeah. Okay, so this one. Would be monitoring. And this one is gonna be evaluation. And then this one is going to be monitoring. So then what's the indicator?
How many services are being offered?
So the number of services being offered? Any other indicators?
I would say instead of offered, but received. Like the number of HIV services received by, HIV services received
Okay.
by Asian bisexual men.
Any other indicators? Uh-huh.
I'm thinking kind of broadly, but like, what if it was like increase in the number of HIV clinics, or like, so instead of the services, we're thinking about where are they receiving the services, or is, do you think that's
No.
still, okay?
Not, remember, this is your, what if we talked about the percent of HIV services? So the percent of services being offered, and then you could also do the percent of HIV services. So up here we've got the number, down here we've got the percent. Okay, so then what becomes our source of evidence for this? How do we know that we have more services?
The Haitian record of services for that keeps tallying all the services and
So okay, let me translate that. Let me translate Jake's speak into public health speak. So what you're saying, Jake, is you're gonna have a resource log that you're gonna look at. So we're gonna have that pre and post intervention. That's what you were saying, right, Jake? Got it. Okay. What else could you look at?
Could you do observations? Like, I don't know, I'm trying to think of like a way you could observe, but I guess like you could track the amount of Haitian populations that you serve before the intervention, and then track.
Well, but if you're increasing the number of services or the amount of services, what you could do, which kind of gets at your, what you're talking about, is you could do what we call a windshield survey. So again, this would be something that you do pre and post. Windshield survey basically means that you drive around and you look and see what's there, what's in the community.
You drive around like is in the clinic or
The community. So if you're thinking, think if larger. If this was, like we're gonna increase the numbers or the amount of services in a community for this population, now we can drive around and we can see how many surveys or how many things are there. The other thing that you could do related to this, and I know they don't cover these in research methods, is doing an asset map. So an asset map is like where you can take this data from your windshield survey and put it on an actual map. So you get a map of the defined area, okay, like a street map, and you get it blown up poster size, and then you can go through and you can like use dots or pens that have balls on them with different colors, so you can say, these are the ones that are here now, pre-intervention. These are where new sites have opened. These are new organizations. However you want to map it out, you can map it out. You can even show here's where things have closed, kind of thing, but it shows on a map. And if you do it with color-coded dots, then everybody can go, oh, I see, So you could, and then you could have so you have a big map, and then you could have your legend down here with your different colors showing this is what's going on. And asset mapping is actually in your packet on the social assessment as ways of getting participation. So if you want to know more about it there, it should be there. Probably will be taught in community-based participatory research if we ever get enough people to take that class. Whole minor detail. So, makes sense? And so, whether it's monitoring or evaluation, you're still going to have these same indicators, and here you're going to have these same sources of evidence. Okay? Makes sense? And so, like, you know, like as you guys work through a problem, but then as you start thinking even about your own evaluation plans, you may choose, well, I'll have you do outcome monitoring and outcome evaluation. So you may choose, you know, you'll have to choose both of these, but then, you know, you'll have to explain which indicators you're going to use. Personally, I think going with the percentage ones are going to be better because you've got a percent in your objective. So then it ensures the calculation. And then you might have several of those sources of evidence and then pick whatever one you want to go with. Okay? All right. So you guys ready to do this? Yeah, okay, whatever.
Is this gonna be part of the quiz or the midterm?
This will be part of the midterm, and this is also part of what you have to do for your evaluation plan. So, yeah, you need to become proficient at doing it.